It is preventable and it is treatable, but malaria continues to kill about 660,000 people globally each year, with 9 out of every 10 deaths occurring in Africa. In Africa, Uganda ranks third in the number of deaths attributable to malaria, with the highest malaria transmission rates. Now, simple measures like sleeping under a mosquito net, especially one that has been treated, are what can save most of our children. But Rahma here has spent almost a month without sleeping under one. She is susceptible to malaria. In Uganda, malaria kills about 320 children every day, a number the malaria control program in the Ministry of Health says is starting to decline.
Because in some districts, the deaths have totally reduced, even in Malawi itself.
He says before, fever was diagnosed as malaria with just a touch. Now there is a rapid diagnostic test that can see the parasite that causes malaria. On the global rankings, Uganda is still doing badly. According to the World Health Organization, 219 million cases are estimated to occur around the world each year. Uganda and 5 other African countries, Nigeria, Democratic Republic of the Congo, United Republic of Tanzania, Mozambique and Cote d'Ivoire share 103 million cases annually of the 219 million cases. Uganda has tried to look at the preventive side and treatment side. Unfortunately, malaria continues to maintain its #1 position in killing Ugandans, especially children younger than 5 years. Dr. Lugemu asserts that the use of treated nets goes a long way in preventing malaria. In May, the president will launch a reception of 21 million nets from the Global Fund, Presidential Malaria Initiative, DFID, World Vision, amongst other development partners.
And that will take us to about 1 net for every 2 people, meaning that in a household, if there are 6 people, they should be able to get 3 nets, thus giving greater protection for almost every person, unlike we've been doing in the past, where we are giving pregnant women and children under the age of 5.
According to the World Health Organization 2012 World Malaria Report, the number of insecticide-treated nets bought in 2012, 66 million, is far lower than that of 2011 at 92 million and 2010 at 145 million. However, Uganda has not been buying mosquito nets.
That's a question that should have gone to the Minister of Finance and members of Parliament. But as a country, constitutionally, we are supposed to do that. People are getting enlightened. But sometimes it saddens you when you go to a place and you find you've given somebody a net, he's using it for fishing. You're giving somebody a net, he's using it for catching ants. This is blind ants and swa.
Ime Nansamba shares her untreated net with her husband and baby.
Now those are 4 years with that one net. Don't you think it is odd?
A net, according to WHO, must be used for not more than 3 years. Some people are unable to afford to replace the mosquito nets when the government-donated ones wear out.
The pregnant women will continue getting these nets through their antenatal clinics, because malaria is one of the #1 cause of abortion, stillbirth, severe anemia, and death in pregnancy. We have also motivated a program where a child, when you take her for immunization, he may get a net.
Apache district in northern Uganda has most of the world's infectious mosquitoes, where one person is bitten by 1,564 mosquitoes every year.
On the average, a person is bitten by about 3 mosquitoes. 1 mosquito is enough to give you malaria, but a person in Kabale is bitten by less than even 3-4 mosquitoes a year, which are infected. That's why malaria in places like Kabale, Sebei on top of the mountain, are less.
The Ministry of Health now wants the implementation of the law enacted in the year 2000.
Chapter 268, I think Article 1 to 90, it alludes to malaria as a nuisance, and it's chargeable. So if they found you having, harboring mosquitoes in your house, or even creating environment for mosquitoes to breed in, you should be liable to prosecution.
The Ministry of Health is trying out vaccines against malaria in Iganga, eastern Uganda, as part of the strategy to control the spread of malaria in the country. For now, there is no vaccine against malaria. Florence Nalimba, NTV.